garment district is abuzz. Carts jostle and deals are made. Stores are stocked. Meals are served. At first glance here, COVID has been conquered. Living and making a living seems easy again. But venture into the back lanes where seamstresses work for a few dollars a day, and you'll see the stitching is a little slower, the customers fewer. Too many of the stores Hu Wei-yong rents out sit empty. Since the lockdown, he says, Wuhan seems like a dead city to me. It's like we pressed the pause button. We're very afraid, still living in the shadow of COVID. The scars of this scare are never far from the surface. Making money doesn't seem as important anymore, says Lu Lihua. Just living is the priority. This central Chinese city was the first to feel the full consequences of COVID after the virus was discovered here in January. A metropolis of more than 10 million on the Yangtze River, shut down and cut off from the world in a matter of hours. Many in Wuhan look back on the lockdown as a nightmare, though now few dare criticize it publicly. There are stories of people feeling imprisoned in their own homes, sometimes quite literally, with the doors welded shut. They talk about shortages of food and medical care and a serious lack of reliable information. As the rest of China was preparing to celebrate Lunar New Year, the orders to lock down came from Beijing. 加油, Wuhan! 加油, 中国! Within hours, people were ordered into their homes. Police rounded up residents suspected to be sick. At the time, it all seemed so draconian, the kind of thing only a dictatorship like China might do. But there was reason to panic. The deadly virus, apparently spreading from stalls at the city's seafood market, was taking its toll. Bodies were collected from apartments all over the city. A grim count of corpses piled up outside Wuhan's hospitals. Inside, there was plenty of grief at the bedside. My father, he says, he's gone. He stopped breathing. Hospitals were in disarray. Patients parked in hallways, shortages of doctors, beds, and equipment. It didn't have to be quite so frantic. As early as December, 1 month before, a Wuhan doctor alerted his colleagues to a strange new disease infecting patients. But Dr. Li Wenliang was silenced by police. He later died from COVID, becoming a popular hero as whistleblower. Today, Wuhan's seafood market, considered by many as ground zero for this pandemic, is closed, decorated outside, abandoned on the inside. But around here, none of it is forgotten, certainly not by Dr. Yu Chengping, who was on the front lines as COVID spread and ended up being the first doctor infected in January. COVID wiped him out for 3.5 months, he says in a rare interview with Western media. I was very weak after I got sick, he says. It was life-threatening. I lost some 15 kilograms, and even now, I have trouble breathing. But as a doctor, I learned a lot. He says the Chinese government didn't recognize the seriousness of the problem at first because the number of infections seemed low. But he says once it did, Beijing did the right thing with a strict lockdown. That's why it's so difficult for other countries to control the virus, he says. Isolation is so important, yet people elsewhere insist on freedom. So while North America and Europe struggle with a deluge of COVID cases, officially there hasn't been a single locally transmitted case here in months. Nothing to distract from lazy afternoons fishing on the banks of the Yangtze or busy Saturdays shopping downtown.
Oh, that's him on stage.
Still, the human cost remains high for Xi Shuli and her husband. A musician she can only watch perform on her phone now. Back in January, right as Wuhan's lockdown was starting, he collapsed at home with a high fever. She went from hospital to hospital trying to get him admitted, finally finding one that wasn't already full. Doctor sent him straight into intensive care, ICU. He had COVID. I'd heard COVID stories. I was so afraid, she says. I was so sad and afraid I would never see him again, she says. I was just left with his clothes. Wuhan is full of sad stories this year. Still, many feel they've survived tough times and even dodged death. They drink to continued health and even to Wuhan's nightmare lockdown, which many think the world needs to emulate.
So, Sasha, almost a year later, very few cases. Given what's happening around the world, is there a worry about yet another wave there?
Well, Adrian, people are afraid of this virus. They've gone through all of this. But because of that, there are a lot of people who also have this strange sense of immunity, that Wuhan is okay if they can only keep COVID out. And China has put up some pretty big barriers for people to come in. It's very difficult to come into the country right now. If an infection is discovered, they have a very intensive system of tracing. That's true in every city in the country. And they also do massive testing. They went through that in Wuhan itself back in May for the last time, but not since.
Okay, Sasha Petrusek in Beijing tonight. Thank you, Sasha.
My pleasure.